name is Craig Long. I'm a general practitioner. I currently practice in San Antonio, Texas now. The structure of the program begins with what we call boot camp, and you actually do get a very good education about lasers in general. You were asked to do some required reading before you even came to the classes. So that was a great way to start learning about lasers, because at that point when I started using the peri-laser, I didn't know that much about lasers and their physics and the ways that they're used in dentistry and medicine. So that structure was a good deep background for us. I think as students go through this program, we become in some ways laser experts. And I think Dr. Griggs and Dr. McCarthy wanted us to be in that area. If you're going to do this, let's really know how it really works. And that structure is a good foundation to begin with. How are we going to use the laser to help do the LANAP protocol and help patients in dentistry? Once we do that, the icing on the cake in the structure of this program is, okay, you've been in a lecture, you've seen the slides, but it's not the same as going and doing the procedure. So then we provide the avenue and the ways and means to do the surgery and do it 3 times in the program, where you become so proficient in it that you're ready to treat almost any case in any patient. Why I became an IALD instructor? That's a question I've asked myself a lot of times, and it's been one that I've never regretted the decision. When we first started doing the laser way back, and I've been doing the laser 16 years now, and I started instructing actually after only having the laser about 1.5 years. We bought the laser back in those days on good faith. And once I got to know Dr. Griggs and Dr. McCarthy, I saw their integrity. I saw some of the results that they were getting with the laser. This was prior to Dr. Yupna's studies, so we just kind of bought it on faith. It looked good. Their premise at that time, if you don't like the laser, you can return it. So I took the plunge. The first few cases I did, I was totally blown out of the water to see new bone regeneration, to see gums healthy with just doing the LANAP protocol. I had never seen anything like that in my life. I've been doing dentistry for over 15 years at that point. So once I started seeing those results and got to meet Dr. Griggs and McCarthy, at that point they said, would you be interested in instructing? And I said yes immediately, because one, I started believing in the procedure so much at that point. I thought all dentists need to be doing this. If I become an instructor, I can help with that paradigm. Let's start training our profession to do LANAP, because it's going to be beneficial to patients. It's going to be beneficial in some ways to the field of dentistry. If you become an instructor, you need to know what you're doing. So that was also an avenue for me to really dive into the LANAP protocol, periodontal disease, all the ramifications that can be in result of this disease, and how we can help patients eradicate it. So that was my main reason for becoming an instructor, and it's been a very rewarding time. I've gotten to meet colleagues and students who have taught me many things. So it's been a great thing in my career.